My name's Tim McGonigal. Here's my student ID. And I am performing an emergency stent on my friend Gabby here. She is currently an injured soccer player that fractured her tibia. So we're gonna put her in a stent. Typically you want to use something that's really sturdy for the stent. These are 2 water guns. This is the best I had for here. So you want to put one on the inside and one on the outside supporting the knee and the ankle here. Running from the knee to the ankle and past it. For my tie downs, I have latex bands that should work decently. So typically you want to use 3 of them. I'm going to put it under her knee here, and you want to tie it below the knee just to better support the patient. And also you do not want to move the leg to make it easier to perform the stent. That way the patient prevents any further injury and break. So there is the first one, and depending on if it's an open or closed break will determine if you do the middle one here. If it's an open break, you do not want to do the middle one. It can make the break worse or the fracture worse. So since it's a closed fracture here, meaning that it's not sticking out or anything and there's no blood, no open wound, we're going to do the middle one. And there's the second knot. And that should go right below the fracture point, or nearly on top of it. And the last one here will be right above the ankle. And this will better stabilize the patient for transport. So there's that. And typically you want all the knots to go to one direction, and preferably to the outside, just to stay out of the way and make it easier. So there is the third one. And then afterwards, you need to make sure that Gabby still has a pulse, which she does. And then make sure that she can feel. Can you feel my hand?
Yes.
Okay. And then make sure that she has a motory response in her feet. So can you wiggle your toes for me? Perfect. And that is how you perform a stent on the tibia.